Good day, Western Visayas. Once again, here I am, Dr. Anita G. La Cuesta JESENA, your medical oncologist, your cancer specialist. This is a medical corner which would try to share with you, enlighten you probably, educate you of course, and make you fully informed of what a person undergoes when she is diagnosed for the first time. Multidisciplinary team approach by several doctors and several paramedical personnel that will make things easy for you. And of course, the fear factor, and of course, the question of, so how much would it cost? Because the expenses itself, expenses that would be incurred in the treatment of cancer would already be a cost for stress on the patient. But we are very thankful, of course, that we have our field health, we have our PCSO, I would say, we have the government agencies that help out the patients. We go to the DSWD, we go to the proper, there are some interventions coming from government bodies and even some private corporations that may be able to help patients. And the Filipino patient has a very, very wide sphere of influence because she has so many relatives. Probably a niece or a goddaughter would, and relatives would simply help out in whatever manner to make things easier for the patient. On my part, what I would tell the patient is, I would assess the patient, I would evaluate, of course, what needs to be done. If surgery has been done already, then we go on for a systemic intervention, which is chemotherapy. Then if the patient would need radiation, I would radiation therapy is. If the patient would need hormonal treatment, I would have to explain the implications of such treatment. So each of this has an explanation. Each of this needs to be area where you have to educate the patient. And the patient will have so many questions. I even encourage the patient, in order to vent out your anxieties and your fears, write down your questions so that when you come to the clinic, you will be also in control and everything would not rely on your doctor, but you would be there and asking me, Doctor, how come I have this sensation of having this area where I was operated on? Or Doctor, why is it that I don't have the appetite for food? Why is it, Doctor, that I cannot sleep at night? Why do I have sores in my mouth? Why on my nail beds? All of these could be can work hand in hand to make this very stressful situation work well for the patient. Stress management on the part of the patient and the doctor is very important also. It is an understanding, it is a means of communications where communicating with the patient where things will stood, things are out in the proper perspective, options could be given, and proper referral systems could be done. And patient, her psyche, emotional, her emotional makeup, her sense of perspective, what kind of a person she is. It is one way of knowing how to help the patient cope with this disease. Now, stress. Stress is a fight or flight phenomenon. And I would tell the patient, the mere fact that you have undergone the first part of the treatment, of the process, which is a biopsy, and you know that it is a disease, it is a cancer, then you must be brave and come up with the next part of treatment. It would be very stressful, but we will help each other cope against this disease. And that is why we have the bosom friends. Here in the Western Visayas, I think that was last 2001, when we had the Bosom Friends Incorporated, because our founder, Mrs. Maggie Hapelenia, when she was diagnosed with cancer, that she really didn't know how to cope with it. She didn't know whom to ask for. She has to call a friend in Cagayan de Oro to tell her what is she to expect during treatment. And she founded this Bosom Friends Incorporated. And we are glad that there were women who came out and be a part of this bosom friends, and we help each other coping in the coping of this disease. And with Mama Giafilenia, then we had Dr. Doris Mendoza, who became a very able leader also, and she handled the Bosom Friends Incorporated for so many years. And now we have Ma'am Edith de la Cruz, who is our president. And we are not recruiting members, but we are asking females with breast cancer, come and join us, because you will learn a lot and you'll be empowered a lot. And the stress factor of being diagnosed with breast cancer, and how we handle this with a medical oncologist, with your family members, with your support groups. No? So actually, ang importante na din sa babae is we want the women to be empowered. We want them to educate themselves. If you want to know things about your disease, go ask your doctor, go read to the internet, but verify that what you read is something that is really worth reading. You can go back to your doctor again. So we want us also to have a certain degree of control over the disease, because we have a God who is above all of us, and it's only God who can tell us our lifetime here on earth. But for the meantime, we will enjoy life, have a good quality of life, because it's not the end of the world with this diagnosis. And so, dear Ilonggo women and women all over the world, we are the empowered women. We are the new women of this decade, and we are women who are educated, and we are women who can push through with what we want with our lives, because we know what we want, and because we know that there is something out there that would be a big boost to our health if only we would know how to tap them. And for those who would like to make inquiries or ask questions, you can just email us at goodday, which is gooddaywv@yahoo.com, which is gooddaywesternvisayas@yahoo.com. So ask us anytime. If we could help you, then willingly we will be very open to you. And I would say that having cancer is not the end of the world, but it will open new horizons in your life, which you would even say that here you are getting more fulfilled and getting more beautiful, because now you're empowered and you can put one over this disease. Thank you.